Hi, I'm Dr. Trone Lodog. I'm with the Pharmaca Health Advisory Board. And today I wanted to just talk to all women who are of the age group where they could get pregnant, right? You know, 50% of pregnancies are unplanned in the United States. Doesn't mean they're not wanted, just means they weren't planned. And there are a few things you really need to know if you're sexually active and you possibly could get pregnant. Folic acid is one of the most important vitamins that you can take to really protect you and your future child. Folic acid, we get this from the word folate is what's in food. It comes from foliage, right, from the same root word. And so you get it from eating lots of dark leafy greens. And it's so important to your health that we actually fortify a number of our foods with folate to make sure women get enough. Even with all of this, according to the large government study that was done through the CDC, we know that 90% of women do not get enough folate in their diet to meet their needs, especially if they should become pregnant. Okay, so what if you should get pregnant? The time that you need folic acid is actually right around the time of conception. So if you're like many women and you're not planning on getting pregnant, you miss your period, it's 2 to 3 weeks later, you take a pregnancy test, then you go in to see the midwife or the OB, and now you're 6, 8 weeks pregnant, and you start taking your prenatal vitamin. Too late. Too late. We need that folic acid on board early. This is why I strongly recommend all women who could get pregnant either take a folic acid supplement or take a basic multivitamin that provides 400 micrograms of folic acid every day. Because if you really want to reduce the risk of your baby having birth defects, you have to have the folic acid on board at the time of being pregnant. A couple other little tips for you. If you are of reproductive age and maybe you're thinking you might want to get pregnant, prenatal vitamin or multivitamin important before you get pregnant, but also make sure you talk to your midwife or your healthcare provider about, am I taking any medications that could be risky for my baby if I should get pregnant? About 3% of birth defects in the United States are actually due to medications that women are taking at the time of pregnancy. So if you're on medications for seizures or for asthma or for blood pressure or for mental health purposes, make sure you're talking early to your prescriber and to your OB or midwife. Are these medications safe if I should get pregnant? And if you are trying to get pregnant and the medications are a problem, ask if there's an alternative for you. And of course, I would encourage you to talk to the pharmacists at Pharmaca. They're also a great resource for being able to go over your medications with you and tell you if there's any problems.